Good morning. This is Dr. Jennifer Thill. I am one of the emergency medicine emergency department physicians at Mid-Valley Hospital. I am also the hospital's chief medical officer, and welcome live from Zoom. I am coming to you this morning recorded instead of live in person at the hospital due to our restrictions that are back in place for visitation, in addition to the increased numbers that we are seeing traffic-wise for people who are ill or injured through the emergency department. And so you're in my living room. Things that are different about this particular COVID surge with what is predominantly the Delta variant now, both in our county and across our state, and also across the United States, is the range of symptoms that we're seeing. So not everybody is coming in with a cough and shortness of breath the way we were seeing in the winter and then the early spring with the surge that we had at that point in time across the county in Washington state. We're seeing a myriad of symptoms that are ranging now from people just saying that they're tired, fatigued, weak. We've had a fair number of people whose main presentation has actually been gastrointestinal symptoms like nausea, vomiting, and diarrhea. Of course, some people come with fevers and some people don't. So we're definitely seeing a broader picture of symptoms that are being attributed to positive COVID-19 infection with this Delta variant. We are seeing the greatest numbers of people who are presenting sick to the emergency department in our unvaccinated population. We have had a few cases of people who have received full complement of their vaccines who have tested positive for COVID-19. Now, fortunately, most of those people that we're seeing, and they're relatively small numbers in comparison. One group is our vulnerable patient population. So our older folks, our octogenarians, so people in their 80s who got vaccinated very appropriately, but either because of their age or other medical conditions, they may not have either mounted the protective immune response, or that immune response is waning. And then the other subset of people that we are starting to see some positive COVID tests in are actually some of those people who were among the first to get vaccinated back in December. So keeping in line with the idea that a booster shot is most likely going to be necessary. They tend to represent our least people. So even in our older vulnerable patients, most of them are able to be discharged from the emergency department, sometimes with a little bit of supplemental oxygen. Occasionally they're having to spend one night or two, but that's pretty much it. As opposed to our unvaccinated group of patients who are spending days to weeks in the hospital in our COVID unit. Right now, our COVID unit is full. Unfortunately, we have a maximum number of patients that we can take care of in our what we call our respiratory care wing at Mid-Valley Hospital, due to just the numbers of people that we're seeing that are sick, and several of them have been hospitalized for days. By far and away, the majority of the people that we are testing positive for COVID unfortunately still are in that unvaccinated subsection of our population. Well, unfortunately for anyone coming to the emergency department for any issue, the wait times have significantly increased over the past several weeks. People are being boarded in the hallway on a stretcher in the hallway, unfortunately, which is not ideal. We're having to have people sit and wait in a room that is designated as a grieving room for families if there was an unfortunate passing of a loved one, or just because they needed a quiet place to go, and now that room is being occupied often by a person who is waiting to be seen through the emergency department. Unfortunately, and this is something that we also never want to see happen, is that it's causing people to leave the emergency department after they've checked in without being evaluated. And that is not what we want, because obviously if you've decided to come to the emergency department, then you felt like you needed to be evaluated, and we want to do that. But wait times are really getting longer. In fact, it looks more like wait times that you would expect in a bigger city, when they routinely wait 6 to 8 hours in emergency department waiting room to be seen. And it also means that sometimes somebody who came in by ambulance may get a quick evaluation, and then if they don't appear sick, may have to sit back out in the waiting room. So we are just really struggling to be able to care for the number of people who are presenting through the emergency department, because of the difficulty with, we're seeing sicker people, the difficulty with finding either an inpatient bed at our facility or at an alternative facility, and then just really having a lot more people show up. So all of those things are sort of crashing together in what would be called the perfect storm. Your waits may be longer than you expect or anticipated, and we ask that you show some kindness to the staff and not get frustrated with the longer wait time. Not only in the county, but across the state, all of the hospitals in the state of Washington are full. And in fact, the conversation is starting to pivot across the state among the different emergency departments and hospitals about trying to stay out of what we call the crisis standards of care, in which case we either have to, unfortunately, make decisions to ration care, or to not be able to care for somebody at all. We have well surpassed the maximum numbers of patients that were being admitted for COVID-19 in the winter in the state these past few days. That number is over 1,500 now per day, rather than the 1,200 that we were seeing back in the winter months, when we had a fairly significant surge at that time. If we have people who come through the emergency department, we always have to evaluate first whether or not they would be somebody who we could adequately care for at Mid-Valley Hospital, considering that we don't have ventilators or respirators or a way to take care of somebody who needed to be on more advanced oxygen support than just either a nasal cannula oxygen or a simple face mask. Those people are waiting in the emergency department now for sometimes 6, 10, 12 plus hours, waiting for the possibility of a bed at a higher level of care facility. And that's if we're lucky. Sometimes they're being boarded for 2 or 3 days. We have certainly had patients who have been fairly critically ill and beyond the capacity of what we could care for at our hospital on our acute care side, and really even stretching the limits of what we can do in the emergency department, but simply cannot find a bed at any facility across the state because they're all full and boarding people in their emergency department. So most of the time when we're told our patient is put on a wait list, they're 30 down on the wait list, because that's how many people are waiting in the emergency department at, let's say, Swedish or UW or Virginia Mason or Sacred Heart or one of these other hospitals that we would potentially be able to transfer someone to. Central Washington Hospital in Wenatchee has been on basically interfacility diversion for weeks now. And it is a rare instance when we're actually able to transfer somebody to our normal higher level of care, which would be just down in Wenatchee. People are now going to Spokane and Seattle, which is well outside of what we would normally refer to as our catchment area, so that people could stay in the region or the area, which is really putting a strain on people and their families, because then it's much more difficult for someone to come visit their loved one in the hospital if they're in Bellingham as opposed to down in Wenatchee. I certainly feel like everyone knows about themselves and has the ability and the right to make decisions. But I will just, as a medical professional, say that in general, and continuing even with the Delta variant, we are still seeing a substantial protection from the vaccination as compared to people who are not vaccinated. And so we urge everyone to please consider getting vaccinated, for yourself, for your family, for your friends, for your community. And even vaccinated or unvaccinated, we know that our infection control measures work. You would never see your surgeon come into the operating room without a face mask and having washed their hands. Masking, washing your hands, and social distancing, that 6 feet apart, still for anyone, vaccinated or otherwise, still are super important for us to be able to control and manage this virus and try to hopefully get a handle on it and start seeing a downturn in the numbers of people who are positive in our community.